How can you see me? I don't know why they make this so difficult. I really don't. It's too, I mean, you know what I'm saying? Why? All right. There. Can you see me okay? I look crooked. I am crooked. Maybe I sit like that. All right. All right. We're good. All right. So here's the question. I guess it's better if I just talk, but I really need to pull up my PowerPoint. So right now I have my PowerPoint pulled up. Can you just see me? Okay, cool. All right. We're good then. All right. Thank you. Well, in a couple minutes. How's that? Okay. Okay. Morning, everyone. It's almost afternoon. We're just waiting till noon to get started. So, good afternoon. My name is Colleen Farron. I'm here talking to you today at the invitation of Your Life, Coconut Creek, a lovely memory center that is in Coconut Creek, Florida. And I want to make sure everyone can hear me. If Jillian is on, if you'll give me a thumbs up so you know that I'm coming across nice and clear. I am sitting in one of the bedrooms of my house, and behind me is my dog Tux. He's a big black dog. He's an absolute sweetheart, and he tends to hang out with me when I work in this room. COVID has changed all of our lives, hasn't it? I spend an awful lot of time looking at the closet, which is in front of me, and turning around and staring out the window to look at the trees. I appreciate the opportunity to talk to you. And what we're going to do today is I'm going to talk a little bit about what it means to have dementia versus normal aging. I am an occupational therapist and I am a rehabilitation manager for a Medicare certified home health company called Trilogy Home Health. I have been an OT for almost 40 years. I'm a certified dementia practitioner. So suffice to say that I have spent a lot of time dealing with older adults and some of the younger adults with young onset dementia, and have taken a lot of classes. So I kind of have my head wrapped around the differences between these. Um, Trilogy Home Health is a certified Medicare home health agency, and we provide psychiatric and med surg nursing in the home, physical therapy, occupational therapy, speech language therapy, medical social work, dietitians, respiratory therapists, and home health aides. All those services are covered by Medicare Part A, still at 100%. We're very hopeful that Medicare does not play around with the home health benefits so much because we know that it's very valuable. The objectives of the next half hour of me talking to you is to have a high flyover overview of what the process for normal aging is, of the recognition of what happens potentially when people start to have some changes due to dementia, and understanding what the mitigation factors are and what we can do to lessen the onset of dementia. So, the aging normal adult body goes through lots of changes per system. Your heart and your blood vessels start to stiffen, makes the heart work harder. Physical activities become more difficult, walking up hills, walking fast. Some of this stuff everyone can relate to. Our muscles lose strength, lose flexibility, lose endurance. Did you know that muscle mass decreases 3 to 5% every decade after being 30 years old? 30 years old. So consider what happens when we get to 60, where at that point it starts a bit of an uptick. Our bones shrink in density, makes them more fragile, more likely to break. The cartilage in our joints changes. It lessens the padding between our bones, causes stiffness and pain. And some of us, of course, end up with joint replacements. Our skin loses elasticity, results in wrinkles, right? We're more fragile, more apt to bruise and to tear easily. Our bladder and bowel changes as well. We have structural changes. We have lax muscles, connective tissue. Sometimes there's an increased urgency, less control. You have changes in your diets and what interests you for food. So that affects often our bowel habits. Vision changes as well, right? Normally, people become more farsighted, and cataracts are a normal part of aging. The lens on your eye starts to cloud up a little bit, builds up too many proteins. Our hearing changes, the blood flow changes, nerves, some become very hard of hearing. So the aging brain also goes through changes. Traditionally, a normal aging adult has some shrinkage. And there are five major lobes of the brain that we talk about: the frontal lobe, the parietal lobe, the occipital lobe, the temporal lobe. And then we think about the cerebellum in the back of the brain, and we think about the brain stem. All of this is a very micromanaged, orchestrated dance, if you will, that happens every moment in your brain, firing nerve cells and nerve bodies connecting and talking to each other. And like everything else in the body, the brain is also apt to go through some changes. Normal aging includes the following: a slowness with thinking, right? You just have to stay on task a little longer. Maybe your attention isn't as good as it was. You have a decreased sustained attention. You could have increased challenges while multitasking. You're trying to talk on the phone, make a cake, and listen to what someone is saying to you when they're walking into the room. And you literally stay, okay, hold on a second. Can we slow down? I'm doing too many things. Let me pay attention to what you're saying. You could also have word finding difficulties. I find that a lot. It's really frustrating. Occasionally, you'll misplace things and you'll think, where was that? And you kind of have to backtrack through it. Overall, though, normal aging cognitive changes, routine skills, memory, and knowledge stays pretty stable. All right. When people have insight and they worry about memory and cognition changes, that's all very normal. You know, if I say to my husband, oy vey, I don't know why I can't find these words, he will just laugh at me and say, well, honey, it's part of getting older. You know that, right? Now, dementia, on the other hand, is a very different critter. Those same body changes that I talked about, skin, bones, bowel, bladder, all of that is also going on at the same time. But there's pronounced differences that are going on in the brain. And it's related to the collective death, unfortunately, of brain cells, depending on what type of dementia it is. Dementia is a brain disease. It's caused by damage to brain cells. And when we have damage to brain cells, they're unable to effectively communicate with each other. And in order for the brain to work well, all those cells have to be communicating in an orchestrated way all the time in order to make us as normal as we are. When brain cells don't communicate well, thinking, behavior, and feelings are all affected. Different types of dementia affecting different parts of the brain cause different types of problems. Dementia is not a specific disease. It's an overall term that defines a group of symptoms that are associated with a decline in memory or other thinking skills that are severe enough that it reduces a person's ability to perform everyday activities. Dementia can cause many cognitive changes, emotional changes, sensory, physical impairments, vision, depending on the area affected. So it's very much a brain-based disease, and in particular, where in the brain we're seeing the changes. There's 150 types of dementia that we know about at this point. That's a lot of dementia. And there are probably lots more that we don't know about. But the most common types are Alzheimer's, vascular dementia, which happens after multiple strokes that people have, frontotemporal dementia, alcohol-related dementia, Lewy body dementia, Huntington's disease, normal pressure hydrocephalus, too much pressure that builds up in the brain can cause a dementia, something called Creutzfeldt-Jakob disease, mixed dementia, Parkinson's dementia, posterior cortical atrophy. I can go on and on. It takes a skilled clinician, a skilled physician to try to determine what type of dementia there is. The symptoms of dementia in the big picture are different from what we see with normal cognitive aging in a normal older adult. And I'm going to put normal in quotes because not everyone was normal to begin with. So The issues with dementia become holding on to, forming, and storing recent memories. We still may be able to grab some long term memories, but what I just did a while ago, or what I did yesterday, or who I spoke to could not be encoded at all. So I'm not going to be able to tell you. um, Increasing problems with communication and language, understanding often what's heard, and then formulating an answer that makes sense to that statement or question. Really impairing, increasing ability to focus and to pay attention. Problems with reasoning and judgment, safety, insight, and issues are not identified. For instance, wanting to drive when your partner, your spouse, or your family members are telling you constantly you don't have the attention, you're unsafe on the road, you don't know where you're going, you've gotten lost, and not having the insight to understand that those are big picture safety issues, that I need to be listening because I don't store that information, so I don't know it anymore. Problems with visual skills and visual perception. Unlike cataracts, unlike disease based things, these literally are changes, shrinkage, malformation of the visual field. Poor insight into all of those deficits. Family and friends are concerned. Unlike normal cognitive aging, family and friends may see it, but it's not impacting the day to day activity, it's not impacting the safety. And then overall, as dementia gets worse, we see a progressive decline in all kinds of function, the ability to bathe and dress, the ability to prepare food, to manage money, to make sure that the environment is safe, to remember when physicians' appointments are, or birthdays, or names of people. All of that starts to decline. Other symptoms that caregivers, family members will tell you about is a change in personality and mood, difficulty naming items, that close member's name, can't come up with it. You've been married to this woman for 60 years and you can't remember her name. Forgetting the function of items. If I give someone a scissor and they take it and they try to write with it, that's an item that they have forgotten the function of. Repeating questions over and over and not retaining the answers. Taking much longer to complete customary task, one that's been done day in and day out. Misplacing things, not having any insight into that, not being able to retrace steps or getting lost, confusion with time or space. Where am I? What day is today? What year is this? Are you at the doctor's office? Where are you? That sort of stuff. Now, given all of that, some dementias are reversible, believe it or not. Depression, significant depression, can cause dementia, but when treated, you will see that cognitive skills resume. The same thing with some medications. They also can cause dementia, but when dealt with and managed, the, the symptoms are reduced. Alcohol abuse, drug abuse, dietary deficiencies, vitamins A, C, B12, and folate, all those things can contribute to a type of cognitive change that's reversible once treated. Brain tumors, traumas, hormonal dysfunction like thyroid impairment, metabolic issues, dehydration, kidney failure, chronic obstructive pulmonary disease, infections, heart disease. One of the reasons that physicians do such elaborate tests to try to diagnose people is they're really trying to rule out other possible causes of what appears to be cognitive impairment. The diagnosis is not easy. There is no one test. I think we're coming up on a blood test for Alzheimer's, some genetic testing. I don't know that that's going to be in the next few years, probably in the next 4 to 5 years. But in order to collect information, physicians want to take a careful medical history, a physical examination, lab tests, and scans, the evaluation, if you will, of characteristic changes in thinking, day to day functional skills performance, behavior being exhibited. I think that it's very interesting that all of this has come to play in the midst of the political atmosphere that we have right now. You may have seen our president talking at length about the cognitive testing that he's undergone. He actually took something called the MOCA, which is the Montreal assessment of cognitive behavior. And that is a test that is very, very much designed to collect recent information, to test the fund of knowledge for naming simple items, to help test calculation abilities with numbers. So there's just been a little bit of information about that, but it's called the MOCA, M-O-C-A, and it's a very well-known test that's provided as a screening tool for those people with dementia. So we kind of have that big picture of what the difference is. I think that it's very important to talk about how we prevent all of this, do the best job we can to mitigate the symptoms, to bring down the risk. All right. So to do that, there are 6 pillars: exercise, social engagement, a healthy diet, mental stimulation, quality sleep, and stress management. So taking care of yourself now really plays out well in the long run. So Mediterranean style diets, heart healthy, lots of fruits and vegetables, whole grains, lean meats, fish, poultry, low fat dairy products, less solid fat, sugar and salt, good sized portions, and adequate fluids. That's healthy eating. All right. Getting at least 150 minutes of exercise each week. So that's about 25 to 30 minutes a day. Now, when you consider that walking is included in all that, this is not such a tough barrier. We should all be able to get about 30 minutes of at least walking activity. But any kind of arm exercises, any videos that you may watch, any exercise groups that you go to, all of that will reduce the risk of dementia. It will also help to make you strong so we can prevent falls, right? We can keep strength up and coordination. Keeping your mind active is really critical. Do stimulating activities, perform those: books, magazines, play games, teach yourself a new craft, take a class if you can get out, or take something online, or take something with help from your family, friends, and be social, interact with people. All of that really helps to keep your mind active. Practicing healthy sleep hygiene habits is very important. So trying to stick to the same sleep, I'm having, talk about word finding, I'm having such problems today. Sticking to a daily sleep wake schedule. Try not to nap for more than 20 minutes. Exercise every day. Get morning sunlight exposure. It really helps to reset some of the hormones that are in your brain to put you back on that nice schedule. Limit alcohol because it suppresses a lot of sleep waves and cycles. Avoid stimulants like caffeine after 6 o'clock. And sometimes a small light snack with a little bit of protein and a little bit of carbohydrate, like cereal and milk, really helps to increase the amount of melatonin so that it helps you fall to sleep easier. Managing comorbid diseases, taking care of pre-existing heart disease, any sort of osteoporosis, making sure that if you're a diabetic, that you manage those diseases. Blood pressure issues, cholesterol issues, they all build up. They're very important to stay on top of. And then stress reduction. Stress reduction is really important because think of how hard the brain and the body work when we get anxious, when we get depressed, when we get distracted with something that is a very big concern to us. So there are many ways. Some people engage in prayer. My mother will say her rosaries over and over, and that simple prayer that's repeated in and out that she knows for 82 years, 84 years, right? Calms her whole system down, gives her something to focus on, and then she can breathe a little more easily. So we bring the stress down. The other thing is some breathing techniques. One of them is called a 4-7-8. And what you do is you breathe in for 4 seconds, you hold it for 7 seconds, and then you breathe out twice as long, which would make that 8 seconds. And you do that in a series of four, and then you rest. And the attention paid to the 4-7-8 technique, as well as that focus on a long, slow exhale, really helps to reduce stress. There are simple mantra meditative techniques that you can do, progressive muscle relaxation, The world is your oyster when it comes to stress reduction. If you go onto into the web, you'll see lots of information about that. So, in summary, there are many types of dementia. It takes a qualified medical professional to determine if what we have is a dementia or something that can be reversed. And taking charge of our day to day activities so that we exercise enough, we socialize, we eat well, we engage in mentally stimulating activities, we get good sleep, and we manage our stress really helps to prevent dementia. I hope that this has been helpful. I hope that you have enjoyed it. I will take any questions if Jillian's able to give me any questions. But if not, I can be reached at Trilogy Home Healthcare. There's a Broward office, and my name is Colleen Farron. I hope that you have a good day. Please take care. Bye bye.